Assalamualaikum and hi, my name is Siti Nur Amanina binti Ismail Nashruddin and I'm going to present about the sulfite-induced asthma. Food allergy is an immune system reaction that occurs directly after consuming a specific food. Even a trace amount of the allergy-causing food may cause symptoms such as digestive issues, hives, or swollen airways. A food allergy can cause serious symptoms or even a life-threatening reaction is known as anaphylaxis in some people. Food allergies affect 6 to 8% of children under the age of 3 and up to 3% of adults. Although there is no cure for food allergies, some children outgrow them as they grow older. It's possible to confuse a food allergy with food sensitivity, which is a far more common reaction. Food allergy, though annoying, is a less severe illness that does not involve the immune system. Now we are going to learn more about sulfites. Sulfites are preservatives that are used in foods and beverages to delay browning and discoloration during preparation, storage, and distribution. For centuries, sulfites have been used in the production of wine. Sulfites also can be found in some foods and drinks as well as medicines. In the 1970s and 1980s, the use of sulfites as preservatives in food and beverages increased significantly. Due to reports of serious reactions to sulfites, the Food and Drug Administration (FDA) imposed a ban in August 1986. The use of sulfites in fresh fruits and vegetables was prohibited under this prohibition. While reactions to sulfites were first reported in restaurant and salad bars, this has not been a source of sulfite exposure for more than 3 decades. Next is use of sulfites. Sulfites are used in potatoes, seafood, and beer or wine, as well as in the pharmaceutical industry. It has been linked to asthma symptoms ranging from moderate wheezing to potentially life-threatening asthmatic reactions. It is also a very rare cause of anaphylaxis, which is a generalized allergic reaction in people who have acquired a sulfite allergy. It is used in many drugs, including those used to treat asthma and allergic reactions. As you can see from slide, sulfites are used to preserve a variety of beverages and food. However, sulfites are prohibited in many countries from being added to foods such as fresh salads or fruit salads, as well as meats such as minced meat or sausage meat. Although being prohibited, most countries allow the addition of sulfites to beer and wine. To make it more easy to learn, the following table shows some of the most common causes of sulfite exposure. For example, the common causes of sulfite exposure is usually in cordials, fruit juices, soft drink, instant tea, and also beer. For fruits, the common source we can observe is dried apricot, and sometimes grapes will be delivered with sachets of the sulfite-containing preservatives. However, sulfites are not commonly found in dried sultanas. When people with sulfite-sensitive asthma eat or drink sulfite-containing foods or drinks, their asthma symptoms can be worsened. The incidence of sulfite-sensitive asthma is estimated to be variable. The majority of reactions occur as a result of inhaling, which is breathing in the sulfur dioxide from sulfite-containing foods or beverages. Hives and itchiness, sore stomach, diarrhea, vomiting, difficulty breathing, and all those that being mentioned are all the symptoms of a sulfite allergy. After we have known what is the sulfite-induced asthma, we also should know the mechanism for adverse reaction. Firstly, inhaling SO2 can induce an airway reflex contraction. As SO2 is inhaled during the swallowing process, this mechanism can explain the rapid onset of symptoms when consuming liquids like beer or wine. Certain asthmatics who respond to sulfites have a partial deficiency of the enzyme sulfite oxidase, which aids in the breakdown of the sulfite dioxide. Some people have positive skin allergy tests to sulfites, which suggesting an IgE-mediated allergy. After the mechanism for adverse reaction, we should also know and understand what kind of side effect can happen on people with this kind of allergy. According to the Food and Drug Administration (FDA), an estimated 1% of the population is allergic to sulfites, and about 5% of those people also have asthma. Consuming this compound can irritate the respiratory tract in people with asthma who are sensitive to them. Those who are sensitive to these compounds can experience headache as well. Other possible sulfite side effects include hives, swelling, abdominal pain, diarrhea, and in extreme circumstances, anaphylaxis, a serious and possibly fatal allergic reaction. Last but not least, we should know what kind of treatment can be given to those experiencing this problem. The purpose of treatment is to keep symptoms under control. It can be accomplished by avoiding sulfite-containing foods and beverages. This will necessitate the close reading of food and drug labels. When dining out, extra precautions must be taken. Antihistamines, corticosteroids, and an inhaler containing medication to open the airways can be used to alleviate symptoms. Some people may need the use of an epinephrine pen. It may be used to administer medication in the event of a serious reaction. In conclusion, if you have asthma and sulfites cause an allergic reaction, you must avoid them at all costs. This can be difficult, particularly because sulfites are present in many foods and medications. Even a trace amount can trigger a reaction. You may avoid sulfites by reading labels, asking the waiter or waitress if the food you are ordering contains sulfites, and asking your doctor what to do in an emergency. To avoid a potentially dangerous situation, you should always bring a rescue inhaler and an EpiPen with you. Next, we are going to the Q&A session. The first question is it common to have a sulfite sensitivity? The answer is, if you are not asthmatic, sulfite sensitivity will be very unusual. If you do have asthma, your chances of being sensitive to sulfite is in the range of between 1 in 40 and 1 in 100. If you suspect you may be sensitive to sulfites, you should be evaluated by a board-certified allergy or immunology physician before starting on a program of lifelong avoidance of foods and beverages that contain sulfite. For the second question, which is, does people who react to sulfites do need to avoid sulfates or sulfur? The answer for this question is, sulfates and sulfites are both sulfur-based compounds, but they are used for different things. Sulfates are usually harsh chemicals added to soaps, detergent, and other cleaners. Sulfites are more natural and act as preservatives. Hope this explanation can answer the questions. That's all from me. Thank you.